Working with COVID in the lab has been very difficult, and we have an even bigger workload to have to deal with, and we might be running out of reagents, running out of COVID kits. My name is Noe Lopez. I am an MLT student here at Western Piedmont Community College. I chose to go into the medical laboratory technology because I really like the science behind diseases and just seeing all the different specimens that come into the lab and actually being able to take care of a patient without having direct contact with them. I definitely do feel that I'm very ready to enter the workforce once clinical is over with. I feel like I've received a really good education and good training. It really is a big family, big whole community setting within the lab, and we each, help each other to reach the final goal, which is to provide, good care to the patient and make sure that that they're able to get better and leave the hospital in good shape as well. It's been a really long journey coming to this point in my life because DACA has really made it very difficult, and I feel like I've had to work twice as hard just to be on the same level as every other student, with always working and not being able to receive government assistance. But it's honestly made me stronger in the end, because I know that if I can overcome those barriers, everything else in life that hits me will also be overcome. It's very important to be a good example to my younger sisters. And it also makes me really happy that I'd be the first one in my immediate family to actually have a higher degree. It can be difficult sometimes, but just know that being a good person and always including others and being nice and working hard will get you where you need to be.